So today we wanted to take just a few minutes to go over our planning efforts over the next few weeks and try to give some definitions around terms you may be hearing both from the Director of Health and within our own communications that come out from the Health Department. So we're going to begin with this idea of medical surge and what does that actually mean as it applies to Union County. As you've seen from both state and federal press conferences lately, there's an emphasis on this idea of a medical surge. And what they're referring to is this idea that there is such an overwhelming, sudden number of cases of COVID-19 that require critical care, emergency room access, that it overwhelms a healthcare system. So there's no longer beds, there's no longer physicians available, there may not be ventilators available for folks who need them. And that obviously poses a number of concerns for anyone who needs to use the emergency room, not just for COVID-19, but also for any type of illness that on a day-to-day basis the ER may see. A car crash victim, a heart attack, a stroke, something like that now is competing with all the other illnesses that are overwhelming that system. So what can we do to help our system prepare for that surge? What can we do during the middle of that medical surge? Well, there's a couple of ways that we can start preparing for it. As we've talked about flattening the curve and delaying that surge, which all of our social distancing efforts seem to be helping with. You've seen that in the press conferences from Governor DeWine. We're delaying the impact. Each day we delay gives us a little more time to prepare. So as of right now, our preparations look something like this. We are in the process of identifying what our current capability is within the healthcare system, what we can expand to immediately, and what supplies we need to garner in order to make that expansion occur. Starting to talk about alternative care sites. Where can we move individuals to if the hospital is overwhelmed? What can we do to divert folks who don't need emergency room care but still need some level of care? And where can we send those folks so that they're not competing with folks who are critically ill and not exposing themselves to people who are critically ill who go to an emergency room system? We are working on things like a phone triage system to help handle calls and answer questions, and a way to follow up on patients who perhaps are deferred from the hospital because of the surge, but still need some amount of care. And that would include working with our paramedicine programs, our EMS folks, and even our local docs, who we are. Now, the question of the surge keeps coming up. When will it happen? Well, it's not clear when it will happen. The best the modelers can say is within the next few weeks. And that's based on the data that they're looking at from other communities that have gone through the same epidemic outbreak that we are experiencing in Ohio. That slow build and then a sudden explosion of cases. There is no question in the modelers' minds from our OSU folks and the state epidemiologists that a surge will occur. Each day we can delay that surge gives us that much more time to prepare. It also gives us time to reach out to people in our community who may be able to help us during that surge. We know we will need more folks with healthcare backgrounds to help out, whether it be on a triage line, whether it be an alternative care site, or whether it be even within a hospital system. So we have put out an ask for anyone who has a background in healthcare, whether they are currently licensed or a student, a retiree, or even someone who may be on a leave of absence from their current job for whatever reason that may be, a personal reason. If you have a background in healthcare, we are asking you to consider volunteering through our Medical Reserve Corps and provide us that opportunity to use your talents, your experience, and your knowledge to help us during a medical surge. We will continue to keep you informed as that surge starts to build and what the new models say. You can watch the Director of Health and the Governor every day at 2 o'clock for the press conference to get that source of information, or you can follow our own website and social media platforms to see where we stand in regards to our preparation and that surge. Again, all the efforts at social distancing, physical distancing, no matter where they are occurring, helps delay the start of that surge. It gives us more time to prepare and plan. If you have questions about the surge or anything regarding COVID-19, please take a look at our website devoted to coronavirus or check out the state's coronavirus website.